Hi everybody, welcome to my first dinner with the doc. This is my first Facebook Live event, so bear with me and feel free to say hi or post any questions. I probably won't answer the questions until the end, just because it might be a lot to try to read the questions and what I'm trying to say at once. So for those who don't know me through the horse world or haven't met me yet here, my name is Jordan Koivu, and I am a 2015 graduate from the Atlantic Veterinary College in PEI. I recently moved back here in January, but after graduating from PEI, I was down working in New Hampshire for a year doing a rotating internship in medicine, surgery, and lameness at New England Equine. And then for the past couple years, I was working out in Calgary, Alberta at TD Equine, where I did a lot of lameness and sports medicine there. So between those two places, I got to work with a lot of really great veterinarians and developed a really strong background in lameness, which I'm continuing to try to improve on all the time. So also in 2017, I did certifications in chiropractic and acupuncture, which are two therapies that can really add to any maintenance or wellness program for any level or discipline of horse, whether it's a young horse competing or an old geriatric horse that's sore. So I am the new full-time vet for Sunny Coast in Nova Scotia and New Brunswick at this point. We're offering a wide range of services, with our focus mostly being lameness, diagnosis and treatment, developing and then helping to monitor rehabilitation plans for any injuries or weaknesses, and then also integrating alternative therapies like chiropractic and acupuncture into maintenance programs. So I thought tonight that I would touch a little bit on chiropractic and acupuncture and how they can help and how they work for horses. So I'm sure many of you have personally had chiropractic or acupuncture on yourselves, and then some of you have already used it on your horses, but I do find that they work best together, but some people find one works better over the other. It's kind of different, and it depends on the horse and their issue, just like humans. So with chiropractic, it's a manual therapy that is used to detect and treat restrictions in joint mobility. Anytime a joint is not functioning as it should, we have decreased performance due to abnormal pressure on the tissues around it. So whether it's muscle, vessels, or nerves, it doesn't allow that area to function as it should. So chiropractic works to restore that joint mobility, and then that allows those structures, especially the nerves, to function at their full potential. There's been a few studies done on chiropractic to show that it works. Probably one of the better ones is from 2008, and it showed that chiropractic adjustments significantly increase the amount of pressure required to cause discomfort in horses' backs for up to 7 days. So in other words, it took more pressure to cause discomfort after horses' backs, or in horses' backs when they received a chiropractic adjustment. So essentially made the back more comfortable. And then moving on to acupuncture, as many of you are aware, it's a very old therapy that originated from traditional Chinese medicine, and many of the practices are based around that today, and the balancing of energy. From a scientific perspective, most of the acupuncture points that we use are actually located near big nerves, or where nerves branch or come together, different vessels or muscles. So by stimulating certain points, we cause nerve stimulation, increased circulation, relaxation of the muscles around that area, and decreased pain through the release of natural painkillers from the body like beta endorphins and natural opioids. There's been a lot of scientific studies on acupuncture to show that it works, which include basically that pain tolerance was significantly either relieved or increased following acupuncture, whether it was plain acupuncture with dry needling or electrical stimulation. So acupuncture in general, when we do it on horses, can be anything from dry needling, which is basically just putting the needle in the point and stimulating that area, to electrical stimulation, which is attaching electrodes to certain points, causing the muscles to twitch, and then also aqua puncture. So aqua puncture is when we inject substances like vitamin B12 at certain points to get a stimulated response. The technique that we use depends on the horse's symptoms and how they respond to each treatment, and sometimes what their certain issue is. So that kind of sums up my chiropractic and acupuncture. If anyone has any other questions about the two, I'm happy to talk to you about it, or we can schedule an appointment and try either on your horse. But both are two really good modalities that you can add into any maintenance program, essentially. So thanks. It was nice to do my first Facebook Live event. And I'm sure I'll be meeting a lot of people in the next couple weeks. But if anyone has any questions, feel free to send them my way. My next talk, I'll probably be talking about soundness exams and why they're so important in preventing lameness in general, and how soundness exams differ from lameness exams, and just how they're basically very important in maintaining a healthy horse, because they are used to catch lameness issues before the issues actually arise, which saves us a lot of time and money in the long run. So yeah, I'll check out the questions, but let me know if anyone has anything, and I'll see you guys soon.